So, the major clinical features of renal calculi, we have already said this, that is renal or ureteral colic will be occurring. So, in renal colic means the pain characteristics. This thing you all have to mention in your exam sheets and all, and you have to seriously kept in mind that is renal colic and ureteral colic and how it will they are different to each other, and where does the pain occur, and how it become radiated, and etc. So in renal colic, it originates deep in the lumbar region and radiates around the side and down toward the testicles in the male and bladder in the female. This is a specialty of renal colic, both in male and female. And in case of ureteral colic that will be originate from the ureter itself, and it will be radiate towards the genitalia and thigh. So as the ureter runs downwards, the pain also run downwards towards the genitalia and thigh. So this is the basic difference between the renal colic and the ureteral colic. So the area where the pain is getting occur and how this will be radiating is the difference between this ureteral colic and the renal colic. So when the pain will be severe, so we cannot express or we cannot explain how which kind of pain is being experienced by a person. So it will be very severe, and along with this pain, when the pain will be severe, some of the associated symptoms will be occurring, such as nausea, vomiting, pallor, grunting, respirations, elevated blood pressures and pulse, diaphoresis, and anxiety. And some of the urinary symptoms, such as that is when the person is having bladder stones. So bladder stones that may result in obstruction of the bladder neck. So this the way to urethra, so that part will be neck will be obstructed due to the accumulation of the bladder stones. So in such cases, some of the urinary symptoms may happen to person. So here they may experience some of the manifestations like urgency, frequency, hematuria, chronic cystitis, etc. And along with that, pressure against the bladder neck during micturition may cause a heavy feeling in the suprapubic region. So the suprapubic region will be having a feeling of heaviness. And along with this, obstruction in voiding. During voiding, obstruction may occur. So the patient may experience several disturbances while doing avoiding, and a decreased bladder capacity and an intermittent urinary system. So the entire urinary system will be get altered if the stone size is more, the pain is severe, and if the patient is having bladder stones, and accordingly this kind of like urgency, frequency, hematuria, and it may persistently occurring means this may develop into any kind of cystitis, that is any kind of infection may happen to person. So such urinary symptom may happen to patients. And along with this, some of the other manifestations, like while we are doing some of the blood investigation, we can see infection with elevated temperature, white blood cells count, everything will be altered, and the patient may develop hydroureter. Hydroureter means accumulation of the water or the fluid within the ureter, and as the condition progresses, the patient may develop hydroureter, leads to megaureter. So hydronephrosis means water in kidney. Hope you remember these conditions or these names we have already studied. So, as the clinical features is progresses, and if we are not treating properly, patient may develop several complications like severe pain may occur. There will be severe pain, hydronephrosis. We have already studied regarding hydronephrosis. Kidney failure. Kidney failure means the kidney, the major function of the kidney. I hope you all know what will be the major functions of kidney. So that functions is not at all happening properly in a person's body. That is, we in coming days you will be hearing like chronic kidney disease, acute kidney failure, chronic kidney disease, and so that kidney failure may happen eventually. Then along with this, patient may develop infection. Several type of infection patient may develop. So some of the diagnostic evaluation, how we could able to identify these renal stones, as we all know, history collection, physical examination, X-ray. In X-ray, we have already studied the radio opaque stones. Radio opaque stones, they will be that may be able to we will be able to identify the presence of such radio opaque stones, as we have studied the calcium oxalate, calcium phosphate, everything that were steroid stones, that all were radio opaque stones, and we have studied one stone, that is radiolucent, that is not able to identify through this X-ray, radiolucent, and that kind of variation we have already studied. Then IVP or retrograde pyelogram, that is intravenous pyelogram, that is to localize the degree and site of obstruction or to confirm the presence of a radiolucent stone. That is, if the patient is having uric acid stone or a cysteine stone, means we are not able to identify through an X-ray because that is radiolucent. So in such cases, we have to identify and we have to locate this kind of stones. We have to follow IVP. Then some of the blood investigation. Blood investigation mainly includes serum calcium, all the metabolites, all the electrolytes, and the basic blood count and all, and the urine studies, urine culture in case of any infection. That all we have to carry it out. Okay. Next one, ultrasonography. Through ultrasonography, yes, irrespective of the radio lucidity, radio opacity, we could able to identify calculus or the calculi in the renal pelvis, calyx, or where they are present. We could able to identify the presence of this calculi wherever in our urinary system. And sometimes the trapped stones, that is in the mid ureter and all, in small grooves and all, these stones may get lodged and they may get trapped. So that also we could able to identify through ultrasonography. Then CT scan, that is to differentiate non-opaque stones from the tumor. Sometimes the patient may feel, or some patient may have the feelings of obstructed ureter, of the patient is not able to void urine. So we may think that okay, the patient may develop a giant renal calculi and all. But eventually we have to identify and differentiate whether it is a renal calculi or a renal tumor. Then urine pH, that is useful to identify the type of stones. We have already seen the struvite stones, they need acidic, that is in alkaline urine, the struvite stone may grow faster. But in case of another uric acid, that different. So the pH may indicate which type of stone patient is having, and for which kind of stone the patient is vulnerable to have more, and all we have to identify. Then 24-hour urine measurement, and here I think you have seen in clinics the patient undergoing 24-hour urine measurement, and also here from for the period of 24 hours we will be kept the patient's entire urine in a large container, and we will be sending to lab for the further investigation. So here we will be checking calcium, phosphorus, magnesium, sodium oxalate, citrate, sulfate, but every metabolites, electrolytes will be checked by this 24-hour urine measurement. So actually this is why we are doing this 24-hour urine measurement, means if a person is having recurrent episodes of or the development of renal calculi, means we have to find out, rule out how much the patient is vulnerable to each electrolyte and how their values getting different in that patient's body. Okay, for that we are doing 24-hour urine measurement. So here we have landed to management. So here in management, as we all know, as usual, we have three steps: medical management, surgical management, and nursing management. So in medical management, so basically our major aim is to alleviate symptom due to stones, especially to relieve pain. That is, the pain will be the major signs the patient will be developing. And we have to maintain a normal urinary system. Then we have to control the progression of the progression of the stone development, further development of the stone we have to prevent. Then we have to prevent the further complications. So this will be the major goals of medical management. So for that we have to focus on four aspects like hydration, reduction of pain, diet modification, pharmacological management. So you all have to seriously keeping in mind these 4 points as a medical management for renal calculi, that is hydration, reduction of pain, diet modification, and pharmacological management. So hydration, as we all know, we have to well hydrate our body because in the etiological factors and all we have seen hydration. Dehydration is one of the major cause, and the climate change is another cause. So we have to facilitate the passage of the small stones, and we have to prevent the development of new ones. So this is our major goal. So we have to hydrate the patient. How we have to hydrate? That is to increase the fluids to 3 to 4 liters daily. Daily we have to provide 3 to 4 liters of water, and we have to maintain urine output 2.5 to 3 liters per day.